Hello, OT friends, and welcome to the Uncommon OT series. I'm Patricia Modis, and I'm your host, a Filipino-American, native New Yorker, currently based in Los Angeles, bulldog mama, and an uncommon occupational therapist myself for the past 22 years. On this podcast, you will hear me proudly feature the unique careers of occupational therapy practitioners working in non-traditional and role-emerging practice areas, settings where OT is uncommon. I invite you to receive a dose of OT inspiration, to learn, to think outside of the box, and to be energized and motivated to follow in these unconventional paths. Happy listening. Before we begin this episode, I want to extend a special thanks to Picmonic, our sponsor. If you are an OT or OTA student looking for an excellent learning resource and study aid, Picmonic might be for you. Whether you're studying for your classes or getting ready for the NBCOT exam, it is a visual mnemonic learning tool that has been research proven to increase retention and help students ace their exams. It uses audio-visual learning and intelligence-based repetition algorithms to help with long-term retention while studying. If you're interested in trying it for yourself, sign up today using the link in the show notes or using the code TRANSITIONSOT to score a discount of 20% off your Picmonic membership. Welcome back, OT friends. Today, I'm excited to introduce you to our guest of honor, Dr. Ivory Rose. She is an occupational therapist who promotes social prescribing. Welcome to the podcast, Dr. Rose.
Thank you so much. I'm just really excited to be here.
Thanks so much for taking the time. I'm very curious about social prescribing and how that is relevant to occupational therapy. So I hope during this time that we have together, you'll be able to fill in some of those gaps for us. Would you get us started by telling us a little bit about yourself and maybe some of your favorite occupations?
Yes, I love this starting question because it just gives a holistic view of us, just like how we see people holistically. So what a wonderful question to start with. My favorite occupations do change with time. I think I'm a pretty dynamic person, but interestingly, several of them really do relate back to childhood. And I've been writing since I was 7 years old, journaling, writing short stories, and a lot of poetry. And so I attend an open mic for spoken word poetry almost every week here in Los Angeles. And I actually have a poem that I'll share with you in a little bit to kind of introduce our listeners to this topic, which might be new for them. And another favorite occupation that I've recently come back to is horseback riding. And I just love the time outdoors, the time with the horse, and even the smell of the horses. It's a whole sensory experience. So that's something I did as a child and have recently come back to as well.
Thanks for sharing some of those. And I love this question for that reason too. I find OTs doing just really cool, amazing things. And I just love learning that about each and every single one of my guests. And I might come see you in one of your open mic shows.
Yes.
Would that be okay?
Absolutely. I'll tell you where to find me. Absolutely.
Okay. Oh, I would love that. Okay. Because I'm in the neighborhood. So hopefully we can make that happen. So thank you for sharing, some of that. Can you share with us a little bit about your OT background?
Yes. Yeah. I've been in OT for about 20 years. And I started in New York City, which I think we found was a common point of interest.
Yes.
In the school system. And they were actually just then starting an innovative program for children on the autism spectrum called the NEST program, which I believe has grown and quite significantly. But it was really exciting to be fresh out of school and part of an innovative program. And that's actually something that's kind of followed me in each place that I've worked since. I've been really excited about innovation and program development. When I moved to California, I initially moved to an area about an hour and a half outside of Los Angeles, and I worked at Loma Linda Children's Hospital. And we called it the Disneyland of jobs because everyone was just so happy to be at work. It was
Oh,
the best camaraderie and rapport. Um, it was just a really magical place to work. You may have heard of it from the Blue Zones documentary. Um,
yes.
yeah, so that was a wonderful place. And then about 9 years ago, I moved to Los Angeles area and started doing home health, and had been doing that with all ages. So they wanted someone that had pediatric experience,
Hmm.
but also all the way up to 103 has been my most elderly client.
Oh, wow. What led to social prescribing?
Great question. I have been really passionate about the impact of volunteering and helping others, how that impacts the health of the giver. And part of this, I think, was shaped when I was in OT school. I was in a therapeutic group process class. The professor was talking about kind of the different therapeutic elements of being in a group. And I misunderstood her, and I thought that she said that altruism or helping other group participants with their growth was even more impactful than catharsis of getting stuff on off of one's own chest. And it was
Hmm.
just this huge light bulb moment. And then I learned that I misunderstood what she was saying, but it just stayed in my mind. And so I came back to it years later and I started to read about the health impact of altruism and learned that I was actually onto something, that
Uh-huh.
there is really a greater health impact when we give than when we receive. So that passion led me to kind of doing some pilot programs where I invited my home health patients to create art for others in need.
Yes.
And I also volunteered at a place for young girls who were removed from their families due to immigration status, quite traumatically, and were in a locked facility, only for immigration purposes.
Hmm.
And I also did some programming with them where they created art for children in the hospital. And I saw that despite their trauma, they loved helping others, even though they
Yes.
were in this country where they didn't speak the language and, had been traumatically separated and had a lot of uncertainty, but they just really loved that they could help someone else. So that led me to pursue my doctorate from Boston University, which was just a wonderful experience, a virtual program that I did during COVID. I started early COVID and it was just a great use of time since
Yes.
there was so much more time at home during that. And while doing my doctorate, I learned that prescribed volunteerism is a one component of this greater umbrella called social prescribing, where
Hmm.
different wellness activities are kind of quote unquote prescribed. And the more I read, the more interested I became in that topic.
You mentioned a poem earlier.
I'd love to share that just to give a little more context. Social prescribing is a relatively new term here in the United States. And so I like to use creative measures to kind of help people understand innovative things. And so I'll share this poem. It's called Less and More. We sleep less, scroll more, touch less, text more. We spend less time outdoors. We hug less. We spend more time under fluorescent lights. We look at the stars less. We look at screens more. We see less stars even when we are looking. We set more timers in an attempt to be more productive. We visit more doctors for our health. The doctors spend less time with us because they have to see more patients. We live in places with more people, yet feel less connected and more lonely. We spend more, yet we are less happy. We live for more years, yet perhaps we are less alive. We drink more and drug more and smoke more just for a feeling of more dopamine, which only makes us produce less and need more. We listen to social media experts more and to our own bodies less. We cry more and hold each other less. We suffer more anxiety and therefore talk to strangers less, not knowing that talking to strangers more may actually lead to more happiness. We judge ourselves more and believe in ourselves less. We are more alone and less in community. So what if we flip the script? What if we moved more and watched TV less? What if we spent more time actually in green places and less time just making pictures of them into our screensavers? What if we spent more time cooking and more time eating and less lunch breaks cramming? What if we helped each other more even when we didn't think it was going to benefit us? Side note, science says it always does benefit us as long as we're not doing it just for that reason. What if we spent more time together and less time in our silos? What if we stopped waiting until we had more health problems before thinking about our health? What if we did more of what actually makes us well and looked less to doctors and more to ourselves as the experts in our own health? What if we looked more to nature and art and movement and eating food that actually has the nutrients we need and to helping each other and to being in community? And what if instead of just paying for more doctor's visits and more pills, which do have their time and place, what if our health insurance actually paid for more of what creates our health? Like coming to poetry night or pottery class or riding horses in the park or healthy cooking class or dance group or capoeira or stand-up comedy for men who have survived a suicide attempt. Or even things that don't cost money, like walks in the park or volunteering or a walking buddy. Well, in 30 countries around the world, healthcare systems are actually paying for these things that bring wellness, and it's called social prescribing. So final question, what if we looked less into bottles of pharmaceuticals for the answers and more into our own communities?
Love it.
Thank you.
Yeah, it just speaks to some of the gaps that I've seen in my work, right? I've seen little holes there where people are falling through those little cracks and not getting their needs met, not getting direction, guidance, or just some kind of support in order to access some of those resources, services. There's this gap in that. And so thank you for sharing your beautiful poem about social prescribing. It provided for me so many examples of the ways that we might think and how that really influences our behaviors, right? And as occupational therapists, that's what we really focus on. And I see that a lot in my work. I'd love for you to tell us more about your uncommon OT work and what you hope to achieve by sharing with us about social prescribing.
Definitely. Thank you. So, as was kind of explained in the poem, social prescribing could also be in very short terms wellness prescriptions. These are typically community activities that are often done in community, meaning with other people. So they're often co-occupations, and that's a lot of what's therapeutic about them. But as an OT, we know that it's not everything, right? It's not just the aspect of community. It's the therapeutic nature of the occupation as well, which I think is what the world of social prescribing doesn't have that context. And I think that's really what we as OTs can bring forth, is really understanding that therapeutic nature of the occupation in addition to the therapeutic nature of being in community and being with other people. So my goal is really to kind of marry these two worlds. I see so much that occupational therapy can contribute to social prescribing. Just to kind of take it back a little bit, social prescribing is thought to have originated around the 1990s in the UK. And in 2018 or 19, it was adopted as part of the NHS's national strategy for health and wellness. So they put what's called a link worker in all primary care. They don't call it primary care offices there. They have a different name for their system, but basically in all primary care settings, there's something called a link worker. To understand what that is, I'll just kind of describe the pathway, because social prescribing is really a pathway of prescribing wellness. And so how that happens is someone is identified usually by a healthcare provider, but doesn't have to be, as someone who has social needs or non-medical needs. And they are then then either directly referred to a community activity or group, or more commonly, they're referred to someone. Here in the US, we're hearing the term more connector, community connector, community navigator. There are at least 30 ways of saying 30 terms for this person, okay? This person is usually not a trained healthcare professional. They are trained in motivational interviewing and in really working with the client to co-produce a prescription. The key question that's quoted a lot in the social prescribing community is, that they will ask the person not what's the matter with you, but what matters to you. And so it's really to be a strengths-based approach and a patient-centered approach. Now, we know as OTs that we might not have used that exact terminology, although there is a former AOTA president who did use that exact terminology, but we know that this has been the way we've operated as OTs for decades, is to really guide the nature of the activity based on what matters to the patient or client, right? So that's definitely, they're really similar core values. But so in this pathway, the link worker or connector person helps the person find this meaningful activity or group in the community. And then the intention is that they help break down any barriers. Because if we think about our clients, what keeps them from taking part in the existing groups in the community? It could be the cost of the group, right? Say they really want to take a dance class, but it's cost prohibitive. Could be transportation, right? They might not have transportation to get there. They might not have childcare. Maybe it's a single parent or a parent where both parents are working. They don't, right? They're not able to get childcare. So the intention of social prescribing is to really assist with those barriers.
Well, it sounds very OT to me. In the holistic sense of the word, where one is really looking at all the different factors that might affect one's performance in their environments. You talked about the linkage to the link worker / community navigator / 500 other labels. Does that typically take place in, I'm thinking upon discharge from an inpatient setting? Is that where that linkage would typically take place, or where we would hope for it to take place?
It could. There's definitely programs that have a link worker embedded into the discharge planning when a patient leaves the hospital. But this is also very commonly happening at the primary care setting. So someone goes in and sees their general practitioner for something that could be met or maybe complemented by a social approach. And then they are referred to that link worker or connector from their primary care physician as well. It could also be a rehabilitation professional, could be an OT, speech therapist, someone working in a mental health setting. And there are even some rare instances where people in the community, like I've heard of taxi drivers and hairstylists being kind of trained to keep an eye and ear out for these things. Because I'm thinking those are professions where people may have a tendency to open up a little about how life is going, right? And so in some areas, and I don't know a lot about that pathway, but people are even being, trained to refer when needed in those community settings as well, which is kind of a whole revolution in wellness, right? Is that we don't even have to get to the medical setting necessarily to say, hey, maybe we should approach wellness in this way. And, that brings up a point is there's definitely been a pushback, not just from OTs, but just in general. Some people really don't like the term prescribing because they feel that it's too medical and that it's medicalizing what we have in our communities to create wellness. And I understand where people are coming from. I personally feel that in the majority of circumstances, the person is already in the medical setting looking for care, and what social prescribing is doing is demedicalizing that care and making it more social and community based
Yes.
versus medical teams going into the community and, you know, testing range of motion and things in the middle of a wellness group. That to me would be medicalizing community and social care. I
Yeah.
don't think, but you know, different people definitely have different opinions on that. And I think it's a great talking point, you know, for
Mm-hmm.
OTs and just people in general to talk about. Um, I also think at this point in the game, the term is not going to change. And
Mm-hmm.
we can either be a part. I always say social prescribing is happening around the world with or without us as OTs.
Yes.
So we can feel a certain way, whether we agree with the terminology prescribing or not.
Mm-hmm.
Um, but besides the word prescribing, what I see as the core values of that client-centeredness, that strengths-based approach, the co-production of a social prescription,
Mm-hmm.
um, you know, all of that to me doesn't sound like a medical model. It really
No.
sounds like a holistic approach that's really client-centered.
Yes. Again, values that really go hand kind of line up with OT values, OT core
Yes.
values. And personally, I think it could possibly have a flip benefit, right? Or a reverse benefit where you're referring to social needs as just as important as medical needs.
Hmm.
And in that case, it needs to be prescribed as well. These prescriptions are out there in the community, right? And it's specifically geared for folks who are not in the hospital because that's where that, that's where they live. Those are their environments. So these are also important things to prescribe because it supports individuals. It prevents relapse. It so I don't mind the term. And I
Yeah.
hope other OTs find a way to kind of embrace the terminology. And again, I feel that it aligns so beautifully with our process.
Yes, definitely. And one distinction that I should make that I didn't make before is that the prescription, it's not always an occupation-based prescription. And I'm advocating for the inclusion of this terminology, occupation-based prescription. Um, but it could
Okay.
also be a basic need like housing, food, you know, food stamps, these type of,
Mm-hmm.
you know, kind of basic necessities that here in the US are typically handled by a social worker.
Yes.
Um, so
Or
those
maybe a case
areas,
manager,
or a
right?
case
And yes,
manager.
yes.
Yeah. Um, so I'm not saying OT belongs in those type of prescriptions
Mm-hmm.
necessarily. I think where we really need to be involved is this area of occupation-based prescriptions, which is a term that I just introduced last week at a poster presentation on the use of occupational therapy to further social prescribing. That I presented at the Fifth International Social Prescribing Conference in London.
Oh, congratulations. I
Thank
hope we
you.
can, not sure if you're able to share that presentation, but I'm sure I'd love to take a look at it and share the
Yes.
link with our listeners.
Yes, absolutely. Yeah, definitely.
Can you define for us what that is?
What OT's role could be?
Yes.
Okay, definitely. So, in the poster, I kind of broke it down into like the micro or individual level, the meso or community, and the macro or societal. At an individual level, say someone is attending a community-based prescription and it is dance class. Um, and they're really passionate about the dance and they love going there. But the next day, every week when they go there on Wednesday, the next day on Thursday, they can't get out of bed because they're so exhausted.
Yeah.
So then on an individual level, the OT could consult with that person, and find ways to manage their energy and conserve energy, right? Whether
Mm-hmm.
it's a modification that happens at the dance class, maybe they're taking part in some of the dancing seated and some standing, or maybe it's their routine at home. Maybe they're taking a shower before going out and about, thinking they want to be fresh, but we know how fatiguing showers can be for our patients with low endurance. So
Yeah.
maybe it's looking at those routines. So that would be an example at the individual level,
Mm-hmm.
or micro. And then a community-based or meso level application of OT would be having an OT at the community site actually running the program, the
Mm-hmm.
occupation-based program, or consulting with different community-based organizations that have occupation centered programming, consulting there and making recommendations for adaptations, use of adaptive equipment, fall prevention,
Mm-hmm.
things like that would be an example at the meso level. And then at
Okay.
the macro level would be, advocating for policy changes, also getting involved in research. And I think very important is contributing occupational therapy terminology. Just like I said, I feel it's important that we start calling occupation-based prescriptions what they are,
Yes.
occupation-based. Um, so contributing theoretical frameworks and terminology to the field. Um, because if we're looking at, say someone's doing data collection
Mm-hmm.
and they're looking at the effect of prescriptions, well, the outcomes are going to be very different for a basic needs referral, basic needs prescription, like assistance with food stamps, than it
Yes.
is for an art-based prescription, which is probably we're going to be looking more at outcomes like well-being,
Mm-hmm.
happiness, anxiety, depression.
Yeah.
So it's a very different. So let's categorize those different types of prescriptions and use this terminology. Um, Looking back to the conference last week, um, out of all the presenters and panels, I only heard the word occupation once, and it was from a young man who has a program there called Thrive, and uses a lot of horticulture therapy. Um,
Mm.
and he said something about meaningful activities and occupations. And I thought, I think he means occupation the way we mean occupation. I don't think
Yeah.
he's saying vocation. And so after the panel, I went up to him and I said, I'm
Uh-huh.
so excited to hear what you meant by the word occupation. I'm an occupational therapist. And he said, yes, I meant the meaning that you're thinking of. And I told
So
him, I
he's
said, I
familiar.
almost,
Mm-hmm.
yeah, I said, I almost fell out of my chair just to hear that word. I was so appreciative. But that was one mention of the word in this whole 2 day conference. And so I think that's, really an area that we can contribute, which is kind of more at that, macro level, I would say. So that's just one example in each category. There are definitely more, and I will definitely share the poster where people can see even more examples there.
Okay, great. Were there other OTs at that conference?
Yes, there were
Yeah.
5 of us, 4 from the UK, and then I was the only one coming from abroad for the conference. It was an international conference, so there were people there. Um, Ireland, Scotland, um, Hong Kong, Singapore, um, several countries that were represented amongst the panels.
Yeah.
Um, yeah, but as far as OTs, it was uh, 4 from the UK and then myself. So I hope that there are many more of us at the next conference.
Yes. So did they have any feedback about your presentation on, because your presentation was specifically about OT's role in social prescribing?
Yes, so it was a poster presentation, and so they were happy just to see, the representation of OT. Um, and one person was scanning, I had a QR code on the poster with my contact information, and one person was scanning it, and I walked up and I said, "Oh, you scan it, and the author just appears in front of you." That's the new technology, and so that's how. And she turned out to be an OT, so I think there's definitely a sense of just really supporting each other as OTs to
Hmm.
be there. And I also was very intentional about whenever I asked a question, if it tied into me coming from the context of being an OT, then I brought that up. Not in a
Hmm.
way, you know, um, definitely when people are in the social prescribing world, they've heard some grumbles from some people, whether OTs or other professions, saying, well, we've been doing this. Um, and so one person said, oh, OT, that's one of the professions that accuses us of stealing this domain.
Uh-huh.
And so, I want to be mindful, of course, to come in that I'm here to serve. I'm here to help our communities just like everyone else in the room. So I don't need to come in accusing anyone of stealing anything, right? That's very important
Yes.
to me to have that humility. But in the same vein, if I can tie in OT to my question, I absolutely will. So, for
Hmm.
example, some experts were presenting about the link workers. There was a study done with link workers to assess how comfortable they were referring patients with dementia to social prescriptions. And they found that there was a gap that link workers that felt comfortable working with other populations really didn't know how to work
Uh-huh.
with people or had some hesitations and some questions and some fear around working with people with dementia. And so I raised my hand when the time for questions came and I said, my name is Ivory. I'm an occupational therapist. And then I asked my question, have you had any success with having OTs train those link workers?
Hmm.
And they just looked at
And
me. They just looked at me. But if that was the planting of a seed, then my job there was done in
yeah,
that instance, right?
yeah.
So I think it's important when we are trying to kind of make our way into a domain where there's not many of us. It's important to come in graciously and with humility, but also confident and knowing what we can bring to the table.
Yes.
And I think that a lot of times I've heard this expression of if OTs are not invited to the table, we have to elbow our way in. And I used to think, yeah, we do. But now I'm starting to think it's not elbow our way in. It's how can we come in graciously? How can we come in um, with grace but strength? Like using kind of balancing those two is really important, I think. Um, because also, Julia Hotz, the author of The Connection Cure, which is the first book ever to be published in the US about social prescribing. And
Mm.
we could link it in the show notes if
Yes.
you want. It
Good.
came out just a few weeks ago, and she was at the conference. She called me the ambassador of OT to social prescribing. And so I take that seriously, that
Yeah.
I'm representing not just myself, but other people in my profession. And so I don't want their impression to be, oh, that's the OT that thinks we're stealing, their
Yes.
domain, right? So I think that's a delicate thing to kind of deal with when you're making your way into a profession where there aren't other OTs.
Yes. And spoken like a true OT because you understand your crowd, you understand your audience and how they need to hear or receive information from you, right? And it takes an OT to understand how much that impacts things. I'm
Great point.
personally super grateful to you for being our ambassador and advocating for us,
Thank you.
and I couldn't help but think of how how could I advocate in my current role for social prescribing?
Yeah.
The term is so new to me, and not that I know everything new. It's just so new to me, and I want it to be more familiar so that I can begin to prescribe, right? Or I can begin
Yes.
to talk to folks about the benefits of that, perhaps. Or I, again, based on the things that you've already described, it sounds like this is innate in what we do. So I wouldn't be surprised if I'm already doing some of this in my current role. Some of the
Absolutely.
examples that you provided earlier really, you know, rang a bell and really hit some points. So, and I'm sure other OTs will also feel that way. So, how do we get ourselves in there? How do we become social prescribers?
Great question. So I've kind of had this two-pronged approach, right? One is teaching OTs about social prescribing, which is what we're doing here today, right? Raising
Mhm.
awareness amongst OTs. And the
Yes.
other prong is going into social prescribing places and teaching about um, OT or just how an OT would address things, right? So that's kind of been
Yeah.
my two-pronged approach. Um, and so there is an organization here in the US called Social Prescribing USA, and it's a volunteer run organization, which I'm a part of as a volunteer. Um, and we have monthly community of practice events, and people are coming from healthcare sector, they're coming from the nonprofit, community-based organizations, some people in the policy world, which we need more of. So it's kind of this really, all stakeholders or all communities of interest in one. And then we're also going to be starting a separate community practice monthly meeting for healthcare professionals specifically,
Ah,
which I'm going to collaborate with Dr. Alan Siegel, who is the medical director and co-founder of Social Prescribing USA. So that's one way to get involved, is to
yeah.
be at these discussions, to show up. Um, I would love to have, by 2025, I'd love to have 20 OTs at Social Prescribing USA. Right now, it's just me. Um, and so that would be a great way, because we don't know how we can contribute to the discussions until we hear the discussions that are happening, right?
That's
So that's really one important way. Um,
Have you
another
been
way,
able to share at the AOTA conference?
I just submitted for both OTAC, which for
Mm-hmm.
people outside of California, that's the OT Association of California. I know you know
Yeah.
that. As well as AOTA. I have submitted to both recently, and I'm just waiting to hear back. And
Okay.
yeah, yeah,
That's a great way to spread the word, right? It's
yes, absolutely.
talking to the masses. So I look forward to getting some of those announcements, and hopefully I'll be able to participate and listen in.
So another way to definitely get involved is let's start teaching our OT and OTA students about this. OTA, I'm not sure exactly what the role would be, because so much of the social prescribing is assessment, I think.
Hmm.
But depending where someone is and at what level they're supporting, I think there definitely could be OTA roles. But
Yes.
I've definitely been focusing more on what kind of OTR roles would be
Hmm.
first, so I could understand that component first. But there are social prescribing student networks that, again, started in the UK, not surprisingly, but they have also expanded. So Singapore, Japan, the United States, Portugal, all have student networks. So
Hmm.
getting students involved. There's also, if there's anyone that listens to this podcast that works in the academic setting and wants to help students start an OT, well, let's actually go back a moment, because before starting a group, they just need to know what it is. So if there are people that just want a lecture, a guest lecture on social prescribing, I've done
Yeah.
that. And, if I'm able to schedule more of those, that's something that I'm happy to do. Eventually, if students are passionate about this and want to get involved, then they could start a chapter of student social prescribing network for students that's led by OT instead of just med students. I think, students are the future. So the more
Yes.
we get OT students involved in this, then the more OT is going to naturally be integrated into this with time.
Yeah. So those are excellent examples. Definitely connecting with the right groups, right? And I know that this is it's more common practice in the UK. So in the US, where would one find a social prescriber?
Okay, great question. So another thing that we can link in the show notes is I've created a Padlet, which is like a virtual bulletin board that has all of the social prescribing programs and initiatives in the US that I'm aware of. I'm giving that caveat, right? And it's a dynamic document that grows as I learn of more programs. So for example, I just found out about a program here in LA where medical professionals and the Parkinson's Association can refer people for adaptive dance class in the community. That counts, right? So just like you said before, we've been doing social prescribing. It's happening under many names, right?
Yes.
So that's somewhere to learn about more programs. But I could give you an example. So Art Pharmacy is a social prescribing program that's offers only art prescriptions. And they started in Atlanta, and they actually have contracts with healthcare insurance companies. The patients that have that healthcare insurance can get referred to their community connector and have this assessment, and then have this co-prescription of an arts-based prescription in the community. And that's been so successful that they actually expanded to the university setting as well. So their first partnership with the university is with Stanford University. And just within the last 6 months, all Stanford students can now have access to, I believe it's a 9 quote unquote dosage of art-based prescription in the community to help with their wellness.
And this is covered by their insurance.
That one is a specific partnership between Art Pharmacy and the university. So I believe there was some grant funding involved in that one. But I do know that Art Pharmacy has partnerships with health insurance, with at least one health insurance company as well. So that is the model here in the US, where there's a direct connection with the health insurance company, whereas some of the other programs are grant funded. The grant funding, it's a way to try something out and pilot and show the return on investment, right? Show that it's actually saving money. I mean, in the UK, there was a figure that I read that people that took part in social prescriptions had, on a national average, 24% less visits to their primary care doctor.
I believe it. In these social prescribing programs that you mentioned, this is where these link workers are employed, or the US version of the link workers.
Okay, yes. In the US, yes.
Okay.
Yes.
And no, are there any OTs that hold any of those roles currently?
Not in the US, not even commonly abroad. I have, in all my research, which of course is not completely exhaustive of the field, but I've come across one instance of a program in New York, in the UK, where the social prescriber was an OT. And instead of that 24% reduced visits, her program had like 37% reduced bit. I mean, they were doing just wonderful work. And it was a very successful program. I don't know why, but I just read that the funding ended just like 2 months ago.
Oh,
So,
that's too bad.
yeah, that's the only instance I've come across where the OT is the connector, which I
Got
think is
it.
a great potential role for OTs, right? Because such a more comprehensive assessment could happen where we can really apply those activity analysis skills to
Mm-hmm.
helping find an appropriate prescription. Because, I think, uh, having worked in home health with the elderly,
Mm-hmm.
sometimes someone wants to take part in an activity or an occupation that's not safe for them, right? And so it's important to have someone with kind of that medical background or understanding of conditions to understand what's safe and what would be an appropriate referral. For
Mm-hmm.
example, um, say a client with multiple sclerosis signs up for an outdoor park-based movement program, and it's Los Angeles and it's hot and it's summertime, right? As an OT, we understand how temperature impacts someone with MS. And, the client might just not have full insight into that, right? So I think coming from an OT background, we can offer even more to that role, or at least be, as we've seen definitely occur in the UK, in a training role to train link workers or connectors about some of these type of topics.
Yeah. I think that that would be an excellent role for an OT.
Or another way that you could start, because not everyone's going to be able to take that on, right? Most of the
Mm-hmm.
listeners are going to say, okay, well, that's a big dedication, right?
Yeah.
Um, I think a great place for us to start as OTs is um, starting to set goals around with our clients around finding a meaningful occupation in the community that they would like to take part in.
Mm-hmm.
And then talking to them about what are the barriers, because not all community groups cost money, right?
Yes.
So it may be helping them find a plan of how to get to the park, or it might be finding a group, or meetups are typically
Mm-hmm.
free, and that's a great way for people to make social be connected to social groups. um, so I think that's one way that people could directly hear this podcast and start to use it in practice immediately,
Yes.
is to start talking to our clients about um, what is a meaningful activity that maybe you used to do or you've wanted to do that you think would kind of just improve your happiness, or make you feel like you have a more fulfilled life, however you want to word it. And start with what's already accessible to you, and then say you identify something and it's not accessible, then see if is there someone in your current practice setting that could help them gain access, you know maybe whether it's a case manager like you said in your setting, or I
Mm-hmm.
know in home health, I would look to the
Home health.
social worker
Hey.
often for something like that. Like, hey, I think it would be really helpful for Mrs. So and so to attend the senior center to take part in this bingo group or something.
Mm-hmm. Mm-hmm.
um say the home health services are ending and the person is kind of ready to get out in the community again, but they need some direction, then
Yes.
you could pair up with someone that could maybe help navigate some of those things. Because sometimes also there are these mini grants that the social workers or other people are aware of, and that could be like through a foundation that's specific to, say, Parkinson's, or like ALS Society has specific grants, you know. Um, so that would be another way, is helping them find something free. If you can't do that, team up with someone in your setting that might be able to help them gain access.
I know we've talked a lot about what social prescribing is, and how does one access it, who's going to pay for it, and thanks for providing the various ways that this can happen. Do you see an occupational therapist kind of maybe doing this for private practice or doing this for private pay?
Yeah, I think it's definitely possible. Kind of the caveat is there's a TEDx where Elizabeth Markle talks about, when our doctor talks to us about that we need to move more or eat better, there's people that have the resources and access to that, and there's people that don't. And are we just going to widen the gap if we are doing a private pay model, that now people that have the ability to private pay can now access this wide array of wellness services. It could widen the gap so I think it's, I want to be mindful about approaching this from a health equity point of view.
Yes.
Which is something that was thankfully really emphasized at the conference as well, is that social prescribing was really designed for those with highest need and least access. Private pay, I think, would not necessarily match that model. Definitely, I made contact with an OT in the UK who is looking to go into something like that and helping support people to be able to get to these community type activities if they're struggling with access. So I don't think it's unheard of.
Yes.
Yeah.
Yeah, I already, in my mind, have identified a couple or a few OT entrepreneurs that I've met over the course of podcasting, who provide a similar service. Because, like you said, we're already doing this. I feel like it's built into my job for me to help them, in fact, access affordable social participation out there in the community. And one example is pet care, being able to access pet care, pet services, right? As that's an important occupation for a lot of our folks, and
Yes.
really requires making phone calls. We have somebody right now who has a cat that needs to be neutered. And because we're in closed space and in shared space, hard enough to, have a cat, but much less a cat who is loud and who's
Right.
kind of, who's creating a ruckus within the dorm. So, this person is in need of affordable pet care, not just a veterinarian, but somewhere that's also nearby so that they can take the bus there. They don't have a vehicle, right? So many things, but these were different things that were considered because of our OT lens. So it's so natural for us to be social prescribers. We'll definitely continue to do what I'm doing. Just in terms of educating, right? You talked about educating from both ends.
Yes.
The ones who already, the OTs, about what it is and how relevant it is to us. But at the same time, also to those who do not know what OT is, and helping them understand the relevance there. Can you talk about some recent challenges and successes in your role or in your promotion of social prescribing?
Successes I'll start with. Definitely being able to be in attendance at the conference last week. To be the only OT that came from another country to be there, which I recognize as a privilege, right? That I was able to do that. Being able to have a poster presentation was a great success. Also, recently, myself and another OT, a wonderful OT in the arts and health world, Liz Barr, we've done a few events to share about social prescribing to OTs, just kind of raising awareness like we're doing here today. And one of the things we did was a book launch for the author of that book I mentioned before, which was just published a few weeks ago. And so I invited Dr. Anvarzadeh, as you know, the AOTA president-elect, and she was in attendance. And that just felt like such success. And, just it really touched my heart to know that she, took time out of her Sunday to be there. But, also made me really excited for the future. And okay, this is now on the radar of, our future president, was wonderful. And then I'll also share a success from the other realm, which is back in March, we celebrated Social Prescribing Day, which is March 14th. And I helped to produce a webinar that Social Prescribing USA put on, where we had some guest speakers and experts come to speak about arts prescriptions and nature prescriptions, as well as Julia, the author, was also a speaker. And that was when I created the Padlet. And after that, one of the co-founders, one of the founding members of Social Prescribing USA said, hey, we're having this in-person event also in the Bay Area. Do you know any OTs in the Bay Area who might want to come? And just the fact that they were asking for OTs now just felt like a big win, because like you mentioned in one of the podcast episodes, I said offline that I'd been enjoying listening to your podcast. And, it's something you mentioned of once they see our value, then they're gonna start inviting us to the table. And that felt like such a big win.
Congratulations.
Thank you.
On all of those wins.
Thank you.
And, to get the support of the AOTA president. Yay, Dr. A.
Yes.
It's great that she makes time, she's a busy lady, she makes time. And I felt that way when she honored me by being a guest on my podcast too. I was just blown away by how, she makes time. And I think that's part of, what makes her a really great leader.
Yeah, absolutely. Yeah.
Yes. But congratulations on your successes.
Thank you.
Incredible.
Thank you. And I don't want to gloss over the second part of the question, right? Because of course there are challenges. Let's be realistic. I think the biggest challenge is kind of how would this roll out in the US and how can we get involved? So how can something turn from a passion to an actual job that we're able to do every day? Sometimes there's days where I just think, am I ever going to get there? Is this passion going to turn into, my next career move? But also I have the benefit of having really amazing supportive friends that say, Ivory, but just look where you were 6 months ago in all of this. And that really gives me hope. But yes, there's definitely challenging days where I wonder, will OT get integrated into this field in the US, which is really my goal, and worldwide.
In your current role, are there any money-related matters that you can share with us? I know we talked about funding a little bit.
Yeah, I think it's grant funding as far as I know. If the listeners know more or have other ideas, I would love to hear them. I think that's also a great way to exchange information. But yeah, what I'm looking at now is really grants and grants that specifically would fund a pilot program. So, and there may be, I know that sometimes like Kaiser will provide funding for a pilot. It's not unheard of, but maybe in partnership with other funding. And also for these grants, they don't fund an individual. So it can't just be, hey, I read a lot about this. I want to start this program. That's not going to work. There really has to be strong ties. I'm grateful looking back that I have these kind of deep community ties that have just come very naturally over the years. And now that it's time to look at, really designing something at a community level, I feel like I have a lot of really strong allies. Yeah. So I think that's a big asset.
It is. And congratulations on that too.
Thank you.
It's a lot of networking, right? And you talked
Yes,
about how this current role is essentially a volunteer type of role for you because you're
absolutely.
basically spreading the word. So thank you for sharing that and for, your transparency. It takes a pioneer, so to speak, right? Just to get the word out there and to get the buzz going.
Yes.
And I really think that you're that person for us. I really appreciate you, taking the time to share with us how we can get involved. Are there any other career advice? I know you've been sprinkling some here and there. That you'd like to share with any of our listeners who might want to get involved in social prescribing. I know you
Yeah.
also mentioned being accessible to them, so I also really appreciate that. What better way to learn more about this than to directly
hmm
connect with you?
Yes, yeah. Yeah, I think, I can speak not just to someone that would want to get involved in this, but anyone that has a passion for something very uncommon, right? Which is most of your
Yeah.
listeners probably. That's why they're tuning in. I can't say enough about how helpful LinkedIn has been.
Mm.
Maybe we can get some LinkedIn sponsorship here. Um,
Well, that's how we met.
Exactly, it is. I've just been really intentional with my use of LinkedIn. You can find your community through
Yes.
LinkedIn, and, maybe 6 months ago, I used to see all these posts from researchers in the field, and, I just kind of felt sad and, some of that FOMO feeling of, wow, they're doing this, and how do I get in there, But I didn't really quite think I wanted to do the actual research. I felt like I wanted to be more in the community implementation setting, which was not a clear pathway for me at that time, right?
Yeah.
But I just followed and engaged naturally with people. People can tell the difference between networking and building community. And networking is more like, I want to connect with you because I want to get something from you. Maybe you can get
Yes.
me a job, or you can refer me to funding. But community is, we have a shared interest and a shared
Yeah.
passion, and I want to have a two-way street with you.
Yes.
And so I just can't say enough good things about how helpful it is to have a community on LinkedIn. And all I did was just start following people that were doing anything in the field of social
Yes.
prescribing. And so that could apply to, say someone's listening and they really have a passion for, something totally unrelated. Well, just following those people, right?
Hmm.
I was at a memorial service within maybe the past year for this amazing speech therapist that I had the pleasure of working with at Loma Linda, who was just a living legend. My former boss, the rehab manager, she shared that when her and this person were brand new speech therapists decades ago, they went to a conference. I think it was in Arizona, and this person walked up to the people that wrote all their textbooks and
Mm-hmm.
invited them to be speakers at a conference that he decided he was going to put together. And he said, but I have zero funding. And these were big names. And they all said yes. And it just really, I walked away with like, wow, what an inspiration. And I got to see this legend in action,
Oh,
it,
that's great.
and so, but that if you ask, you'd be surprised how often people will say yes, And that's exactly how it happened, asking Dr. Nvarzadeh to attend. It was just, well, let's ask, right? Yeah. So I think that's a really powerful piece of advice that seems very simple. But it's hard to do sometimes, but it's really, Audre Lorde has a quote. I can't remember the exact details, but it's something about when I'm doing something in service of my vision, it matters less and less whether I am afraid.
Oh,
I just
that's so true.
so powerful. So
Yeah.
that's kind of a guiding thought for me in just asking.
I follow the same thinking when it comes to podcasting and inviting guests to, join me. Um, yeah, you have to put yourself out there. And I think occupational therapists are also so giving and so willing to share and have this innate excitement for the profession, right? Like we're
Yes.
all really into building ourselves up and supporting one another. So I hold on to those thoughts when I'm making my calls or reaching out. But I've
Yes.
had great success rate and, great percentage. And again, I think for some of those, reasons, OTs are very generous. So just like you are sharing what you know with us and, really teaching us a thing or two about how social distancing can really be part of our domain.
Social prescribing, yes. The opposite of social distancing.
Oh,
Yes.
did I say social distancing?
Yes,
Oh
you
my
know what?
goodness.
It's so ingrained in our terminology, right? But
It
it
was a
just
slip.
shows. No, I think it's perfect because we had to be socially distanced, right? That's why social prescribing is all the more important now, so it's a perfect slip because
What?
it paints a picture of how we got to a place where we really need this.
Are there any common myths or misconceptions about OT's role in social prescribing that you would like to demystify?
I think really we covered it earlier about that. Is this medicalizing the
Mm,
what is social and community,
hmm.
which I view as a myth, and I'm, definitely open to hearing other people's points of view that don't think it's a myth.
Yes.
But I would say, yeah, that's the big one. And also, just I guess the myth I hear from the social prescribing world is that OTs think that social prescribing was taken from us. So that's a myth because we have been doing this, but not in this way. We've not had the funding to pay for these activities that we want to recommend to our clients, right? Instead of feeling like something was taken from us, we just really need to jump in. And we have the benefit that here in the US, this is so new,
Yes.
that we really have a chance to get involved. But I think it's really a matter of time that the
Hmm.
opportunity could just pass us by if we don't get involved. I really feel there's a sense of urgency to getting OT involved in this movement
Yeah.
now.
Yeah, I completely agree. Again, I feel that I'm naturally doing this. Almost sure you'll agree with me that we're really well suited for this role because of our skill set, because of our lens, because of our background and training.
Yeah, I think it's one of the many roles we can play. And I think the way for it to be sustainable would be to prove that it's even more cost effective when you have an OT in that role. That would be the key determining factor,
Hmm.
I think, because the people that are typically in these roles don't have a healthcare education and therefore are making a much lower salary than what an OT would want. I've seen what the connector role plays for the very few companies that have that in the US. And
Yes.
it's not comparable to an OT salary whatsoever. So I think either OTs could be involved in training and education of the connector,
Hmm.
or there could be, studies looking at is it does it save money and is it more efficient and have better outcomes if the OT is actually the connector. Just like that one measure that I shared with you for that person in the UK, that
Hmm.
one OT led program where instead of 24% less visits to the doctor, they had 37 or something like that percent
Yeah.
less visits. So that's a clear case for um, having OT
Success.
as that
Yes.
link worker, right? So I think
Yes.
that would be something that would need to be shown.
Yeah.
Yeah.
So we need to get this pilot going, Dr. Rose.
Yes, absolutely. That's the
We need
starting
this
place.
data. Mhm. Thank you so much again for educating us about social prescribing, for sharing with us your journey so far and your mission and how you're spreading the word and how we can potentially spread the word and also educate our fellow OTs and just the community. Anything else that you'd like to add before we end?
I'm really grateful for you and this podcast. I think it's a great reminder that we all come out of OT school as uncommon OTs, and it's these really profit-driven jobs and companies that we work for that require us to fit into this box. And, acuity and productivity becomes our value, or so we think. And it can be hard to be the creative, uncommon OTs that we all came out of OT school as. So I think your podcast is such a wonderful reminder that we all started as uncommon OTs, and it's important for us to continue to be uncommon OTs. It's really our unique value as OTs.
Well, thank you very much again for sharing with us your uncommon story. You're a perfect example and an inspiring one, because you talked about the urgency, right? Like we need to take action. We need to stake our claim. I feel like we need to put our flag down and, talk about how we've already been social prescribing. So thanks for bringing that to our attention today. And I know you already mentioned earlier that anyone we're interested in reaching out could.
Yes.
LinkedIn is the best place to do so. And we'll add any links that, will help folks find you.
Wonderful. Yes. LinkedIn is great. And I'll also share a link to my new Substack, OT Social Prescribing, for all things social prescribing related.
Okay, got that. We will list all of those things. So thank you again, Dr. Rose, for sharing with us all that you have. I really appreciate it.
Thank you so much. It's been my pleasure to be here and to help spread this word.
And that wraps up another inspiring episode of the Uncommon OT series. Connect with me at www.transitionsot.com. And don't forget to sign up to be part of the Transitions OT community. By doing so, you'll receive my latest compiled list of uncommon OT practice settings, the latest news on mentoring offerings, uncommon OT live events, non-traditional OT resources, and more. You may also follow me on my social media pages on Instagram and LinkedIn. And if you love this episode, head on over to Spotify, Stitcher, Apple, and Google Podcasts to follow, rate, and leave a review. I also ask you to consider pledging your support to my Passion Podcast project by being a patron on Patreon. It is very much appreciated. Sending big OT love. Thank you so much for listening. Until next time.